Welcome to our channel with Russian accent. This video is about virus in China. 2019 novel coronavirus or 2019 nCoV, Wuhan, China. This is an emerging, rapidly evolving situation, and CDC will provide updated information as it becomes available, in addition to the updated guidance. Situation summary. CDC is closely monitoring an outbreak of respiratory illness caused by a novel or new coronavirus, termed 2019 nCoV, that was first detected in Wuhan City, Hubei Province, China, and which continues to expand. Chinese health officials have reported hundreds of infections with 2019 nCoV in China, including outside of Hubei Province. A number of countries, including the United States, have been actively screening incoming travelers from Wuhan, and human infections with 2019 nCoV has been confirmed in Thailand, Japan, and South Korea. The United States announced their first infection with 2019 nCoV detected in a traveler returning from Wuhan on January 21, 2020. Chinese health authorities were the first to post the full genome of the 2019 nCoV in GenBank, the NIH genetic sequence database, and in the global initiative on Sharing All Influenza Data portal and action which has facilitated detection of this virus. Coronaviruses are a large family of viruses, some causing illness in people and others that circulate among animals, including camels, cats, and bats. Rarely, animal coronaviruses can involve and infect people and then spread between people, such as has been seen with MERS and SARS. When person-to-person spread has occurred with SARS and MERS, it is thought to have happened via respiratory droplets produced when an infected person coughs or sneezes. Similar to how influenza and other respiratory pathogens spread. Spread of SARS and MERS between people has generally occurred between close contacts. Past MERS and SARS outbreaks have been complex, requiring comprehensive public health responses. Early on, many of the patients in the outbreak in Wuhan, China, reportedly had some link to a large seafood and animal market, suggesting animal-to-person spread. However, a growing number of patients reportedly have not had exposure to animal markets, suggesting person-to-person spread is occurring. At this time, it's unclear how easily or sustainably this virus is spreading between people. Both MERS and SARS have been known to cause severe illness in people. The situation with regards to 2019 nCoV is still unclear. While severe illness, including illness resulting in a number of deaths, has been reported to China, other patients have had milder illness and been discharged. There are ongoing investigations to learn more. This is a rapidly evolving situation, and information will be updated as it becomes available. Risk assessment. Outbreaks of novel virus infections among people are always of public health concern. The risk from these outbreaks depends on characteristics of the virus, including whether or how well it spreads between people, the severity of resulting illness, and the medical or other measures available to control the impact of the virus, for example, vaccine or treatment medications. Investigations are ongoing to learn more, but some degree of person-to-person spread of 2019 nCoV is occurring. It's important to note that person-to-person spread can happen to a continuum. Some viruses are highly contagious, like measles, while other viruses are less so. It's not clear yet how easily 2019 nCoV spreads from person to person. It's important to know this in order to better assess the risk posed by this virus. While CDC considers this is a serious public health concern based on current information, the immediate health risk from 2019 nCoV to the general American public is considered low at this time. Nevertheless, CDC is taking proactive preparedness precautions. What to expect? More cases are likely to be identified by the coming days, including more in countries outside China, including possibly more cases in the United States. Given what has occurred previously with MERS and SARS, it's likely that some person-to-person spread will continue to occur. CDC response. CDC is closely monitoring this situation and is working with WHO. CDC established a 2019 nCoV incident management structure on January 7, 2020. On January 21, 2020, CDC activated its emergency response system to better provide ongoing support to the 2019 nCoV response. On January 21, 2020, CDC again updated its interim travel health notice for this destination to provide information to people who may be traveling to Wuhan City and who may get sick. The travel notice was raised from level 1, practice usual precautions, to a level 2, practice enhanced precautions, advising travelers that preliminary information suggests that older adults with underlying health conditions may be at increased risk for severe disease. CDC began entry screening of passengers on direct and connecting flights from Wuhan, China, to the 3 main ports of entry in the United States of January 17, 2020. Entry screening will be expanded to airports in Atlanta and Chicago in the oncoming days. CDC issued an updated interim health alert notice advisory to inform state and local health departments and healthcare providers about this outbreak on January 17, 2020. A CDC team has deployed a team to support the ongoing investigations on the state of Washington to respond to the first reported case of 2019 nCoV in the United States, including potentially tracing close contacts to determine if anyone else has become ill. CDC has developed a real-time reverse transcription polymerase chain reaction test that can diagnose 2019 nCoV. Currently, testing for this virus must take place at CDC, but in the coming days and weeks, CDC will share these tests with domestic and international partners through the agency's international reagent resource.